Welcome to the Mental Health Market Update, where we talk about what's happening in the mental health industry. Here's your host, Stephen Hayes.
Welcome back to another episode of the Stigma podcast. Today, a mental health market update, and today we focus on why we at What If Ventures invested in Mindstrong Health. Mindstrong Health announced a Series C investment of $100 million in a press release dated yesterday, Thursday, May 21st, 2020. Links to this press and the details will be in the show notes and available on our website. The press release does a great job of detailing the information of the business, how the current team came together, as well as the details of who invested and what the business is up to now. I wanted to take some time to talk more high level about what Mindstrong is and why it's important and why we invested. Mental health care is broken in America, and you cannot fix what you do not measure. A lot of the care we get is too late. It's ineffective, it's costly, it's based on guesswork, usually by a clinician who tries various medications until you give them your opinion that it's working or not working. And this is killing people. It's unacceptable, and we cannot fix it until we learn how to measure mental health. The lack of evidence-based measurement and testing tools available within the behavioral health industry is, I think, the root of the behavioral health crisis we face today. We've been observing and testing and measuring our physical health since the beginning of time. We've always been able to look at each other and tell who's fat or skinny or fast or slow or tall or short. Then we developed tools. The oldest evidence for the existence of weighing scales is about 2,400 years BC, and the earliest evidence of manufactured mirrors dates back to 6,000 BC. Since then, we've developed a myriad of healthcare diagnostic tools, from basic heart rate monitors to MRI machines and Fitbits and anything and everything in between. So how do we measure mental health? Can we? To date, we mostly rely on clinically validated evidence-based surveys that seem to work when both administered correctly and interpreted correctly. Problem is, most antidepressants are prescribed by general practitioners who aren't getting reimbursed for administering these surveys, and nor are they really qualified to administer and interpret them in the first place. Even if they do hand out a PHQ-9 or a GAD-7, they certainly are not going to follow up with one of the nearly 200 other similar surveys that you could use to follow up and get to the bottom of a real issue. They're also not in position to do any type of extensive counseling. These surveys do seem to be effective to some degree, but I'd rather see some sort of empirical testing used, just as we do in physical health. When was the last time your doctor asked you for your opinion on whether or not you had a broken leg? That's what I thought. Never. They take an x-ray, they find out for sure, and then they apply the right treatment once they've measured and assessed. I want to be clear at the same time here that I'm not saying that the surveys are bad, and there are certain aspects of behavioral health that can only be measured with a survey. Questions about suicidal ideation, for example, require a user's opinion. I'm not trying to say the surveys aren't useful. They are very useful. They would be most useful as a supplement to empirical measurement, though, in my opinion. So why invest in Mindstrong? I believe strongly that investing in measurement and testing capabilities for the purpose of evaluating outcomes, identifying people in need, and facilitating the delivery of care at the right time, in the right way, is a huge opportunity in the mental health space. Doing so will improve outcomes, reduce costs, increase access to care, and provide a whole host of other benefits. We've already seen it in the data from companies that are doing this. I can't share with you private information on companies that have not shared what they're up to, but I can point you to the results of a public company. We've talked about Cadasys before. Cadasys reports their outcomes, which show reducing costs by 50% or more in populations where mental health differences are present with comorbidities such as chronic illness. You can check out my analysis on what Cadasys reported on this topic in their Q1 2020 earnings on the mental health market update from a couple weeks ago. So back to Mindstrong. The first thing I want to highlight here is the technology. Mindstrong has developed a platform that leverages measurement data gathered passively from your smartphone about your mental and emotional state. That data is used to project how your emotional state is trending. When that trend is bad, it alerts a clinician to proactively reach out to you and provide care. Why the smartphone? You touch your phone thousands of times per day, and the way you handle your phone can tell us a lot about your emotional state. This has less to do with the content of what you're doing on your phone, more to do with your interactions with your phone. It's not about what's in your text messages or what website you're visiting or what app you're using or what you're saying on Tinder or Bumble. It has more to do with your physical interaction with the phone. This measurement technology is referred to as digital phenotyping. It's a digital exhaust of sorts. How you handle your phone, how you type, and other behaviors can be analyzed as a biomarker to predict behavioral health trends. You can learn more about how this works in a video with one of the Mindstrong co-founders, Tom Insel, who's also former head of the NIMH, and he's the czar of mental health for the state of California. And he explains this technology in detail, how it works, and why they know it works. And I'll share that video link in the show notes. Another reason we invested in Mindstrong is their care model. This model of providing care exactly when and how we need it, instead of waiting 6 weeks for an appointment to see a psychiatrist, is truly revolutionary. In the traditional care model for mental health, we schedule appointments with clinicians sometimes months in advance. We show up, we give our opinion of how we're doing, maybe we take a survey, then we spend an hour talking to the provider, whether we need to or not at that moment. Mindstrong is the opposite of this. Mindstrong knows when you need help and delivers it, even if it's only a few minutes of texting or a quick call or video chat. This is far more efficient and effective than the traditional care model. The proof is in the outcomes and the reduction in overall healthcare costs for payers and populations using the platform. If you think about it, it's really not that earth-shattering. Everything happening within our body starts off with our minds. It stands to reason that if we treat the mind, the body will follow. So it's logical that we would see these cost reductions in mentally ill patients with chronic illness comorbidities. Another reason we invested in the business is the team. In addition to the technology, Mindstrong has put together a world-class team led by Daniel Graff to commercialize their cutting-edge technology. This technology was developed by the brightest neuroscientists and technologists on the planet, and now is being commercialized by some of the best product development talent around. These are people who have developed or contributed to products like Uber, Twitter, Google Maps, and others that we all use every day. Another reason we invested is we believe that there's potential here for a once-in-a-generation company. Mindstrong is revolutionizing how we administer mental health care. Today, they are focused on treating those with serious mental illness, SMIs, like bipolar, schizophrenia, major mood disorders. In the future, that population will expand. Further into the future, the applications of their measurement and testing capabilities are limitless. At full-scale deployment, I believe firmly that this technology can lead Mindstrong Health to be a once-in-a-generation company that radically transforms an industry that is in crisis today. Those are some of the highlights of why we invested. I wish I could share more, but this is a really exciting business. They're hiring in just about every capacity you could imagine. If you're listening to this and you're hoping to work in the mental health tech space, there are numerous opportunities at Mindstrong today. All of their job openings are listed on their website, which will be linked in the show notes and on our website. They're literally hiring everyone. They even have a job posting on the website titled Anyone. This signifies how hungry they are to put good people to work who are passionate about this problem set. So the last thing I want to say is a thank you. I mean, we're truly fortunate to have been included in this round. I want to say a special thank you to Tom Insel, to Paul Dagum, to Daniel Graff, to Riva Noria, and to our investors for making this possible. It's an honor and a privilege to get to be a part of what you all are doing. That's it for this week's Mental Health Market Update. Short, sweet, to the point. I hope you all have a wonderful Memorial Day weekend. Take care of yourselves, take care of your mental health, and most importantly, find someone who served in the military. Thank them for their service this weekend. And remember, Memorial Day can be a really heavy time for military veterans who have suffered from PTSD, the loss of their friends and loved ones in combat. So just keep them on the forefront of your minds this weekend. And to our listeners, thank you for being here. Please, if you like the content, hook us up with a subscribe or a like or a review on your podcast platform of choice, and share us with a friend on social media. You can find us on Twitter at StigmaCast. You can find us on Instagram at Stigma Podcast. You can email us at info@stigmapodcast.com. And obviously our website is stigmapodcast.com. Thank you again for being here. Please don't forget to check out our episode from earlier this week with Emily O'Brien, who went to prison for drug smuggling and then started a business while locked up. And now she's doing great running that business on the outside. So any entrepreneurs out there who think that starting a business is hard, you should try doing it from prison, and you should hear Emily's story. In an upcoming episode this week, we're going to be sharing a conversation between myself and another bipolar type 1 gentleman named Jason Finnegan. It's a really great back and forth where we share experiences and stories about our mental illness, how we got help, what we are like now. And it really draws out the vast differences that two people with the same problem can experience. I hope you'll join us to learn more about what bipolar really looks like. That's it. Until next time, stay safe, be well, and thank you for your support.